Insulin resistance and diabetes stand among the most prominent metabolic disorders affecting a wide swath of the global population, challenging both individual health and healthcare systems. Individuals with insulin resistance may experience symptoms such as fatigue, hunger, difficulty concentrating, and weight gain, particularly around the abdomen. When insulin resistance progresses to type 2 diabetes, symptoms often include frequent urination, increased thirst, blurred vision, and slow healing of cuts or sores. Treatment typically involves lifestyle modifications like diet and exercise, along with medications or insulin therapy to manage blood sugar levels. Factors increasing the risk of insulin resistance and diabetes include obesity, sedentary lifestyle, genetics, and certain ethnic backgrounds. Here's a deeper dive into the complex world of insulin resistance and diabetes, exploring detailed aspects of the disease. Affected systems, metabolic regulation versus chronic hyperglycemia. Insulin resistance is a condition where the body's cells don't respond properly to insulin, a hormone that regulates blood sugar glucose levels. This resistance can lead to an accumulation of glucose in the bloodstream, a hallmark of prediabetes or type 2 diabetes if not managed. While insulin resistance itself might not cause immediate symptoms, it sets the stage for chronic hyperglycemia, where consistently high blood sugar levels inflict damage across various bodily systems. This includes potential harm to the cardiovascular system, kidneys, nerves, and eyes. The transition from insulin resistance to overt diabetes reflects a decline in the pancreatic beta cell's ability to compensate by producing enough insulin, tipping the balance towards persistent hyperglycemia and associated complications. Addressing insulin resistance through diet, exercise, and medication can prevent or delay the onset of diabetes and mitigate these systemic effects. Onset of condition, gradual metabolic change versus defined metabolic disorder. Insulin resistance signifies the body's diminishing response to insulin, a hormone facilitating glucose entry into cells for energy. It often precedes type 2 diabetes, manifesting subtly as cells increasingly resist insulin's effects, gradually elevating blood glucose levels. If unchecked, this resistance can escalate into full-blown diabetes, where blood sugar control fails, necessitating medical intervention. These interconnected conditions herald a spectrum, with insulin resistance at one end, a covert shift in metabolic response, often lifestyle-related, and type 2 diabetes at the other, as an overt disorder diagnosable through specific blood sugar criteria. Monitoring and addressing insulin sensitivity can thus be pivotal in preventing the more severe, definitive state of diabetes. Primary impact zone, cellular glucose uptake versus blood glucose levels. Insulin resistance marks the onset of diabetes by altering the body's ability to manage blood glucose levels. In this metabolic dysfunction, cells in muscle, fat, and liver respond poorly to insulin and can't easily take up glucose from the blood, resulting in energy deprivation within cells. In diabetes, especially type 2, this insulin resistance is a pivotal concern. Over time, the pancreas struggles to compensate by producing more insulin, leading to hyperinsulinemia. Eventually, the beta cells fail, insulin production declines, and blood glucose levels rise pathologically. This escalation can prompt organ damage and lead to complications such as neuropathy, retinopathy, and increased cardiovascular risk. Understanding and targeting the cellular mechanisms of insulin resistance are crucial in the prevention and management of diabetes. Underlying mechanism: reduced sensitivity to insulin versus insulin deficiency resistance. Insulin resistance is a condition in which the body's cells do not respond properly to insulin, a hormone that regulates blood glucose levels. This lack of sensitivity to insulin causes the pancreas to overproduce insulin to achieve normal glucose levels, putting stress on pancreatic beta cells. Over time, this can lead to type 2 diabetes, characterized by high blood sugar levels due to insulin resistance, coupled with eventual insulin deficiency as the pancreatic beta cells become exhausted. This differs from type 1 diabetes, where an autoimmune response destroys beta cells, leading to an absolute deficiency of insulin. The mechanism behind one's resistance to insulin often involves a combination of genetic and lifestyle factors, such as obesity and physical inactivity, and this condition is a major element of the metabolic syndrome. Addressing the underlying insulin resistance through diet, exercise, and medications can therefore play a pivotal role in preventing and managing type 2 diabetes. Treatment focus: lifestyle modification versus glucose control management. In addressing insulin resistance and diabetes, exploring the differential diagnosis dimension highlights vital distinctions in treatment strategies. A focus on lifestyle modifications emphasizes diet, exercise, and weight management, which can improve insulin sensitivity, potentially reversing prediabetes or stalling the progression to type 2 diabetes. Conversely, glucose control management tends to concentrate on pharmacological interventions, employing medications like metformin or insulin therapy to regulate blood sugar levels directly. Both approaches can be complementary, but prioritizing lifestyle changes may prove fundamental for long-term disease management, reducing dependence on medications and mitigating associated risks like cardiovascular disease, while pharmacotherapy provides more immediate control of hyperglycemia.